First of all, I would like to thank you. Thank you for this invitation to take part in this annual convention of Trivandrum Management Association 2024. I was wondering why Trivandrum Management Association selected such a topic like One Health. For these years, we were, especially health department, we were continuously talking about One Health, especially after Nipah, COVID, and other infectious diseases. And I'm so happy for you, and I would like to congratulate the office bearers of Trivandrum Management Association for choosing this topic, One Health. And I'm so delighted to learn that you had a very good discussion on different topics related to One Health. So One Health, as you all know, it recognizes the intricate connections between human beings, human health especially, animal health, and environmental health. It embodies a philosophy that the well-being of each component of the nature is interdependent on others. So the basic concept is that human health is not an independent one. One Health is not just a theoretical framework, but it's a practical, actionable approach that can significantly impact global health outcomes. It's a universally accepted concept, and it helps in improving the quality of life of human beings. The idea is to identify the interrelationship between humans, animals, birds, plants, and the environment in which we belong, and achieve improved health levels through necessary interventions. Zoonotic diseases like Nipah, as you all know, bats are the natural reservoirs of Nipah virus. We could not yet identify how the exact spillover process is happening. That's how this virus is getting transferred from bats to human beings. ICMR is working on that since 2018. Their team is in Kozhikode and in Wayanad, but that exact spillover process is not yet clear. And mosquito-borne diseases like dengue and chikungunya, etc., are some of the real challenges we face. And you might have read about the avian flu H5N1. So 3 districts, Alappuzha, Kottayam, and Pathanamthitta, now have avian flu outbreak H5N1. And scientific world experts tell us that this virus is getting transferred to human beings. This is something which is going to be very disastrous. Last year in 2023-24, across the globe, around 800 cases were reported, H5N1 cases in human beings. Luckily, not in Kerala till now. And today I had a meeting with my officials in the health department, and we are having new outbreaks in areas like Kuttanad, Niranam, and other parts of Alappuzha, Kottayam, and Pathanamthitta districts. So we are very careful that the virus mutations can happen. It's very rarely that this virus gets transferred from ducks or birds to human beings. But last year, as I said, we had 800 cases, and we are closely observing and monitoring the situation. And if the mutations occur in virus and if it gets transferred to human beings, it will be disastrous than COVID-19. So we have certain challenges in Kerala that we face. The high population density of the state and the travels of our people The increase in the number of elderly people, it's not a challenge. It's an outcome of the good public health activities we have. And the vast forest cover, all are major factors that increase the risk of infectious diseases in the state. In view of such situation, Government of Kerala has decided to implement One Health program in order to improve the quality of health in the state. So what we were doing is that we have specifically rewritten all our health policies based on this One Health concept. And one such good example is the Public Health Act. Even after the formation of the state of Kerala, we had two laws, one for the Travancore-Cochin area and one for the Malabar area. So these two laws were here in Kerala, and recently, last year, Kerala Legislative Assembly has passed the Public Health Act. So we have rewritten the basic concept. Earlier in the Travancore-Cochin Act and in the Malabar Act, it was like the medical officer will be the officer in charge. But in the new law, which our Legislative Assembly passed last year, we have written it in such a way that the public health officer will be the medical officer, but there will be a team at the local level, at the local panchayat level. And that local team includes the agriculture officer, the officer from water authority, the officer or the representative of animal husbandry department, and the panchayat president will be the chairperson of that committee. We have a similar committee at the district level, and all the departments, including the animal husbandry, water authority, pollution control board, everyone will be there in that committee. So this is a change that has happened in Kerala in recent years. We, as our ambassador has told, our visions, our concepts are based on One Health, but we decided to rewrite all the policies based on this concept of One Health. So our health is not isolated. The phrase One Health, all for one and one for all, reflects a holistic approach to health that emphasizes the interconnectedness of human beings, animal and environmental health. The One Health concept recognizes that the health of the people, animals and ecosystems are deeply intertwined. Addressing the health issues requires collaborative efforts across various sectors and disciplines. I would like to bring to your attention some points specifically. And we all know that about this rabies virus. So the Animal Husbandry Department of our government has conducted some wonderful studies, especially their PALO team. And they have found that the viral load in animals, other than dogs, is quite high these days, especially in cows, in foxes, and all other animals. The viral load, the rabies virus load is very high. So last year, you are all knowing about that. We in Kerala, we have more incidents of dog bites, cat bites, etc. And we had a study on this, why this is happening. Because health department is worried more about the health of the people, and we have to provide IDRV, we have to provide the equine. So when you take the data, we understood that the number of dog bites and cat bites, it's increasing in the state. So we had a study based on this, and that study revealed many things. And or one point where we have to focus is this area where not only the dogs, but also the other animals like cows and other pet animals and foxes, even in the forest areas, they have more viral load recently, and they are continuing their studies why this is happening. So diseases like COVID-19, which originated in animals, vividly illustrate the direct link between animal health and human health. There are several instances where the point has been reiterated, such as in the case of Nipah outbreaks. Similarly, environmental degradation can lead to new health challenges for both human beings and animals. Therefore, it is imperative to adopt a holistic view when addressing health issues. We should have a collaborative approach, a multidisciplinary approach. It's not enough for doctors for veterinarians, for ecologists, or for public health professionals. But we need to foster partnerships and dialogues among these diverse fields. For instance, to combat the zoonotic diseases effectively, veterinarians and doctors must work together on surveillance, prevention, and treatment strategies. We can develop more comprehensive and effective health interventions by breaking down these professional barriers.